Now we know where the problem is. How did it start? From A to Z. Stop, pause. Tell me about your week now. What do you do? How long do you drive your car? And what type of physical activity do you do? Do you cross your leg, sitting in the office or during a meeting? On which side do you sleep? At least you just have a bigger picture of how does he load his body on a day-to-day basis, that during his workout, he had that sort of discomfort and kept on building. So during the workout, it's not the movement that hurt him. It's just the accumulation of the, let's say, malalignment and the way he loads his body during the week, and just the workout just brought it to surface.
Yeah.
So I don't blame the workout.
Hello and welcome. Today I'm here with Ahmed. Thank you for making time.
Thank you for the invitation, Paolo.
Absolutely. Ahmed is physiotherapist, and he has, again, as everybody here, very unique and very specific experiences. And his journey is quite interesting. So that's what we are going to get into, talking about his approach, his treatments, and anything where we'll go, there we'll go.
Sure. Yeah,
so no strict guidance. All right, Ahmed. So what was your sport and fitness history when you were growing up?
Okay. Growing up, I was a very lazy child. No sports. I mean, maybe football in the neighborhood, but I was not very active on the pitch as well. By the time I got to university, I started taking care of my health more. And it started from there, the, let's say, fitness journey. I started with normal bodybuilding exercises, running. I jumped into CrossFit, and then into Muay Thai and calisthenics, a little bit of wakeboarding sometimes, horse riding for a few months.
That's a big mix.
Yeah, I tend to try different movements and activities because at the end I'm not a professional athlete. I just train or do some sort of physical activities to enjoy my time. So I tend to challenge my body and my brain on let's say, different perspectives every now and then. Mm-hmm. I just like to learn new movements, adapt to new movements, challenge myself.
Okay, so the exchange of sports or
Yes.
that wide variety, there was actual goal.
Yes.
It wasn't like you got bored or injured.
At the moment, it was me getting bored of repeating the same thing.
Okay.
So I like to change every now and then. Mm-hmm. And because of that habit, let's say, I discovered that my hobby is to explore different stuff every now and then. Mm-hmm. And because of that as well, I understood different sports and what movements do they require. And it helped me a lot with my clients as well. So when a martial artist comes to me, I understand his needs. When a horse rider comes to me, I understand what does he require to improve his movement. Mm-hmm. So it gave me some sort of exposure in different, let's say, sports or entities and the physical activity. And yeah, it added a lot of value.
Well, absolutely. Well, if you experienced it, if you understand it deeper, then definitely you can help better, right?
Yep.
So you said you started doing all these sports on university.
Starting in university, yeah.
Okay, that was when you were already studying for physio?
Yes.
So why you chose physio when you were not active before?
Well, honestly, I chose it because it's a very silly reason why it started, honestly.
Okay.
I saw something on TV and they said that physio is lacking male physios in Bahrain, and whoever might consider it will have a good future because there is a lack in the market. So I chose it completely based on that.
So you're filling the gap on the market.
Exactly,
yeah?
because this is what I want. I did not know what I wanted, and I just wanted a good future, right? Like anyone else. So I jump into this, let's say, opportunity, and during the second year, one of the professors in the hospital took us from the second floor to the fourth or fifth floor on the stairs instead of the elevators. And as soon as we got into the floor, she started having a conversation with us. I was out of breath. And she's like, that was a test for you guys. If you are a physical therapist, you cannot take two levels of, let's say, stairs and you're out of breath. That's not a good indication. And it starts from there. Training, getting better, lifting weights. And this was one of the, let's say, epiphany moments that, you should take care of yourself.
That was your wake-up call for fitness, yeah? Were there, I assume it was not only you, there were more people there.
Definitely.
Also others got triggered like this with this moment?
I am not sure. I'm not sure if they had the same impact. But we were a couple of people who were out of breath.
Nice. Well, yeah, I absolutely agree with this. And that's, when we always have that pull with other people saying, my doctor said this and my therapist said this. And trust somebody trust the opinion of somebody who you trust in that meaning that you see that look at them, how they look. Is what they are saying kind of matching with the presentation, right? If a doctor who is smoking and obviously obese or plainly said just fat is going to give you a lifestyle advice, come on,
Okay. I might disagree a little bit with this approach, because not every football coach can play football. And not every football player can be a good coach. Diego Armando Maradona was one of the best football players, and he failed being a coach for football, right? So not because I know the information, I need to apply it on me. I can give you the advice, but it's not necessarily that I have to apply it.
I absolutely understand what you're saying. However, the trust is not really there.
100%.
Right?
That's the first impression you get from the let's say, medical practitioners who are taking care of you. And on the other hand as well, I think medical practitioners should really take care of what they say and how they say it, because clients take it seriously, right? So as you said, my doctor will tell me, my physio, my whatever the label is.
Authorities.
Exactly. Yeah. It's an authority figure, right? Yeah. So whatever you would say as a medical practitioner, you should pay attention to what you say and how you say it, because it is very important and valuable to the client. And whatever you will say, it will resonate in his head. It might take him up or down. It depends on how do you say it. Because as you said, if I trust this person and he tells me something, I will believe him.
Yep.
If you are in a bad mood, you had a bad day, whatever, you don't drop your, let's say, interpersonal skills and just say it as it is for the patient. You say the truth. But you have to say it in a very nice way, because what you know in terms of, let's say, anatomy, physiology, whatever it is, these harsh diagnoses that to us it's normal because we keep on saying it on a daily basis, it's new for the patient. So sometimes you might tell someone, you have scoliosis. If you do not explain what scoliosis is and what's the degree of scoliosis the patient has, he will go on Google. The first images of scoliosis are not very pleasant to watch. And the patient will build a perception that he will end up like that, or he has the same as what he's watching on.
So basically it's creating not clear picture of the reality.
Yes.
Because of, let's say, inappropriate communication.
Exactly.
That's what you,
Yes. 100%.
Just going back to what you said, Diego Maradona, I absolutely agree with this. I am the absolute example of, I was never talented for nothing, nothing, no sport at all. I struggled with, because I was on uni, I had all the possible sports, right? So athletics, I sucked at everything. Swimming, I was barely staying afloat, I did every single mistake you can do. Yeah. But because I learned the mistakes, now I'm able to explain them. And now I'm able to understand people who struggle. Exactly. Which on the opposite side, people who are very, very talented, they'll just come and do it. They have a hard time understanding what's the struggle. Because for them, it just came naturally. So they don't have that maybe deeper level of breakdown of the movement or whatever activity it is. So absolutely agree with that, because, it's me.
It's how did you develop the experience and your ability to share it as well, right? So you can digest all the information online about a specific topic, but if you don't know how to apply it, if you don't know how to explain it, that's just information in your head. That's another copy of what you read. It's the profound knowledge that you I won't say come across, that you develop based on what did you learn, how did you apply it, what do you know, and based on the case in front of you. For example, if it's a client in the gym that you are training with and you saw a certain mistake, you can tell them, oh, your knee is going in when you squat, you should push it out. That's information, you can read it, everyone knows that. But how to approach it, what's missing is the profound knowledge and the experience you have. Maybe you don't know how to do it, but you know how to analyze it. That's the difference between a coach and someone who just got a degree online and he's just coaching.
Yeah, as we were always saying, you can't. I actually think this was my swimming coach who said that, like, you cannot learn how to swim on YouTube.
Yes,
you need water for that.
Yes.
So you need to get into that environment, and that also applies. That also applies for coaching.
Yeah,
like you actually need to do it to get better at it.
Yes.
Because you need that one-on-one feedback.
Exactly.
I believe that's the same for therapy, right?
100%. And just to go back on what I said, I don't mean to mock or underestimate the online teaching. There is nothing wrong with that. I do that a lot. Most of my courses now I do them online. It's a blessing to live in this era and have access to this information and knowledge easily. But it's not enough. What you learn, you need to apply, and you need to develop your own experience. Because whatever you will learn, is it online, is it a book, is it a conference, is it or a seminar? This is a compound experience by someone who's delivering his experience to you. You take it, you apply it, you see what works, what does not work. You add on to your own experience, and you develop, and then you share it with others.
Yeah.
Right. This is how humanity reached to this level of having an airplane and gigantic buildings. Right. It's just sharing information and the compound knowledge that has been accumulated over and over again.
Yeah, but as you said before, the information is just that one part.
Yes, it's the first step.
Yeah, and then the application, execution, and the actual experience coming, right? Because you can still have, and that probably happened to you before, you learn a new method or something new, a new test, for example, and then you apply it, and you realize that you don't know it at all.
Yes.
Because you knew it on the textbook, but the actual experience is very different.
Yes, exactly. It's called tacit knowledge, that you think you know it, but it's just hidden there. Tacit knowledge.
Tacit knowledge.
There is tacit and explicit.
Okay.
The explicit, the information that you know how to explain. Tacit is, I know it, but I don't know how to explain it. It's like, now you look at my face, right? You know how does my face look like. But if I would cover it and ask you to explain it, you don't know how to explain it. You just know it, right? So always when we obtain knowledge at the beginning, it's tacit. It's just we know of it. We think we understand it in our head. The moment you want to explain it, but you don't know what are you saying.
Yeah.
Right. And whenever someone asks you a few questions, you're being challenged with your ideas, and you think that you don't know enough, that you need to know, or let's say you need to enhance your knowledge on that particular aspect. That's why it's very important whenever you learn something, you teach it.
Yeah. I was just getting there. That's exactly it. If you really want to learn something, try to teach it to others. Because at that moment, as you're saying, in that technical terms, you need to explain it. So you need to understand it to a completely different level. Explicit, right?
Explicit, yes.
Yeah. And then also, I believe it was Einstein, right, who said that if you can't explain it to 3-year-old, you don't understand it enough.
Exactly.
Yeah, because you need to make it as simple as that.
It's very accurate, but I'm not sure if Einstein said it or no. I mean, according to what we read on Instagram, he said a lot of stuff, right?
Yeah, might be somebody very different.
But I agree on the concept. Yeah.
Okay. All right. So you're from Bahrain, I assume. Yeah, and you finished the studies?
Yeah, I studied in Bahrain for 5 years. It was supposed to be 5, was C student.
Mm-hmm.
And I worked there for 3 years in a governmental military hospital. And then I moved to Dubai to work with DISC. Now I've been there for 5 years plus.
Oh, you're 5 years in Dubai?
Yeah.
Okay. So you started your journey to fill in the gap in the market in Bahrain.
In Bahrain.
In Bahrain.
Yes.
But you still
Yeah.
left anyway.
Yeah, because honestly, with time, I realized that, let's say I am an opportunity hunter. I found an opportunity to grow at a bigger scale, which at the beginning of my career, I was aiming to take that pace of growth. But due to certain, let's say, circumstances let's say circumstances, the pace of growth in any governmental sector is slower than the pace I had for myself.
All right. And what were you doing there?
In a hospital, different departments between neurology, inpatient, outpatients, mainly working with surgeons.
But you were working as a physio.
Yeah.
So you were giving treatments to soldiers?
No. It's a governmental hospital, but
I thought you said military.
Yeah, it's managed by military. By the military.
Okay, got it. All right.
So the type of management is completely different than what I was expecting.
Okay.
Yeah.
All right. So you were not like part of army or anything like that. Okay.
No.
All right. And then the pace wasn't good enough for you?
The pace of growth, yes.
Yeah. So you left.
Yeah, it was very steady.
Mm-hmm. It was it like the type of like you can retire there easily because you will just keep doing the same thing for next 40 years and
this is the problem that I don't believe in. Does not make any sense that you just started your career and you wait for your retirement. There is something wrong.
I absolutely agree.
That's a waste of energy. That's a waste of a human brain. That just should not happen.
But that was the reason why you left,
One of the reasons. One of the reasons.
One of the reasons. All right.
I'm just being very diplomatic.
Yeah, I see. That's okay. So we're not going to break any other reasons, yeah? Okay, so you came to Dubai because the opportunities were better. Yes. Let's stay there.
No, it is there. I'm not sugarcoating it. I think I am.
Okay.
But honestly, the reason I moved here because the opportunity of growth was much higher here. Mm-hmm. The team I joined here work on or let's say operate at a completely different level. So before I moved here, the idea of physio and chiro working together and osteo, this did not exist.
Oh, okay.
Yes. So they would work together if they know each other personally, but not in the same clinic.
Okay. So it was very segregated, yeah?
Yes. So the idea that all of them working on the same team, that is, the team is actually diversified and integrated, this was interesting to me. I saw an opportunity of learning and growth in that environment that, I want to be there.
Okay, so what was appealing to you was that you will come into clinic environment, work environment, where you will be meeting all the other possible neighboring, but still different professions like osteos, doctors.
They're under the same umbrella. Mm-hmm. They're different labels, let's say, different type of teaching or education, different perspective on how do they look at the human body, but all of them work toward the same direction, which is making people move better and with less pain, let's say.
Yeah. And which of these, outside of physio, because that's your main one, right, is the most attractive for you?
Chiro.
Which approach? Chiro?
Chiro, yes.
Yeah. And can you expand your education here as well?
Yeah. Because to me, I strongly believe that what we do is a skill, right? You have the foundation of knowledge when it comes to what to do, what not to do, how to assess, what to avoid, and working with them closely and learning under their supervision. I work with the, let's say, top chiropractors in Dubai, if not in the region. And I've learned a lot from their experience, their skills, and they were, all of them, very generous with what they shared with me in terms of information, and I significantly grew with my colleagues. So I think it's a skill that if you dedicate time and attention toward it, you can learn it. You don't need a degree for it.
Okay.
But unfortunately, when it comes to applying it in real life, you need a degree. You need.
That's what I was about to ask. Like, of course, you can learn it from them, and when you have the opportunity, as you went after it, right? I can imagine you were just asking all the questions, the right questions. But that was my question originally meant, could you now apply for a, I don't know, exam or you would need to go through the whole university program again?
Again, there are certain entities globally that you can approach and get the courses online.
Okay.
Now it became online after COVID. Previously, you had to attend in person. Today they offer it online. It's a full course for a few months, covering every single joint in the body, what to do, what not to do. It's a very comprehensive course. You can get it, and you can get, let's say, certified to practice this method. Let's say.
And then with that, you could apply it.
Yeah.
With your clients without any legal issues. Yeah.
Exactly.
Well, that might be the way, right? Because you actually learn it proper way.
Exactly.
Seeing the professionals doing it, they help you with developing that skill. Yes. And then for the papers, you just you just do it online.
I won't agree on. I won't comment on this just because it's recorded. But that's how it goes.
Okay. Yeah, no worries. Nobody will go after you. Well, you never know, but cool. And what do you think, or what you see you are doing differently than other practitioners?
Interesting question.
So everybody has their style and drive.
So to me, mainly, the way I look at my job is I analyze the problem from mechanical perspective. I fix the mechanics and things should follow.
Can you explain it more deeper?
Okay.
What it means, fixing mechanics.
Okay. The amount of people who shows up to the clinic with neck pain and back pain is, let's say, the majority. I don't have numbers to be precise or accurate, but it's most of what we see. Because of the lifestyle we have here in Dubai, we're always being seated, whether it was in a coffee shop, at work, doing a podcast, right?
You can stand if you want.
We're always seated in the car, plane, metro, whatever it is. So what happens here, the body starts to adapt to our movement. And then we go to the gym, we load the same exact muscle that we've been loading throughout the day, right? Because people tend to train, one of the reasons is to look better. So whatever I see in the mirror, I want to see it better.
The mirror muscles.
Yes.
Yeah.
Right? They call them mirror muscles. Interesting.
I heard that expression.
Nice.
I heard it was just, this easy way for people to understand that the mirror muscles and not mirror muscles.
Yes.
The front side and the back side.
Yes. One of my colleagues, Dr. Hassan, always says that whatever you don't see in the mirror, train it in the gym. And I've been adapting my work with this, let's say, methodology, and it has a very positive impact on clients.
So that would be like back,
the
posterior chain,
yes.
Everything on the back side of your body. Because when we said it this way, the first thing that came into my mind that for most these fitness ladies, the butt is also the mirror muscle, right? Because they always turn.
But if you think of it of a mechanical perspective, the hip, one of the underused muscles, and it's one of the most common problem or underlying cause because of back pain. If your hip do not distribute the weight and the load precisely, your back will take the load.
So if the hip is not taking the load accurate as it should,
if you do not have enough mobility, flexibility, strength in your hip, then the weight distribution in the body will be not efficient.
Oh, can you assess that visually?
No, maybe. I don't know how to assess it visually, but in terms, and again, one of the ways that I use that, let's say,
I just, how I meant the question was like, okay, so if you see somebody, you tell them just stand naturally, and they shift to one side, or they lean too much to the heels, or too much to the toes. Like, can you assess that kind of pattern, and then you already can see what's going on or what might be going on?
not a full diagnosis, but at least I can have an idea of what's happening.
Okay.
And yeah, it's doable.
And then you test it.
Yes.
With the muscle tests. Yeah.
Muscle test is one, but to me, most importantly, is analyzing their lifestyle. So
there we go.
Yeah. Yes. So you asked me earlier about my technique, right?
Yes.
What makes my technique, let's say, different or
unique?
Unique? So basically, X client walks in. I have pain in X joint. Okay, since when? Blah blah blah. All this medical history taking questions. Now we know where the problem is. How did it start? From A to Z. Stop, pause. Tell me about your week now. What do you do? How long do you drive your car? And what type of physical activity do you do? Do you cross your leg sitting in the office or during a meeting? On which side do you sleep? At least you just have a bigger picture of how does he load his body on a day-to-day basis, that during his workout, he had that sort of discomfort and kept on building. So during the workout, it's not the movement that hurt him. It's just the accumulation of the, let's say, malalignment and the way he loads his body during the week, and just the workout just brought it to surface.
Yeah.
So I don't blame the workout. It's your day-to-day movement.
That's where it's only exposed.
Yes.
But the root cause is the
Yes.
wrong posture
Yes.
for, I know, out
Yes.
of 20 hours
Yes.
spent in a car.
Yes,
Say.
exactly.
And okay, one thing is that you show them, like, look, okay, you did this and this and this in your workout. However, I don't think that that's the root cause. You just, as you said, surfaced an underlying problem that was already there. And it's because of your lifestyle. They probably like to hear that, right?
Yes.
So how do you, because at that moment it's not about much, I mean, you can show them how to get rid of it, right?
Yeah.
But the application is way harder than anything else.
Exactly, because it starts with, number one, observing your postural behaviors. This is number one. Unless it's a direct injury, it's a direct trauma, that's something different.
Yeah, of course. If you get
hit by a car,
then it's probably a no-brainer where the pain is coming from. But yeah, this is a chronic over time build-up discomfort or injury.
Yeah. So if that's the cause, the number one or the solution starts by observing your postural behaviors. And as soon as you just plant that seed in someone's head, the brain starts doing the work for them. So it's not like I have to remind them every now and then, but I just explain it to them that this is the root cause, the root cause, and this how does it work. So just observe your postural behavior. How do you sit when you drive, for example? Do you feel that your hip is aligned or you're tilted to the side? When you cross your leg, when you sleep, when you wake up, these little movements, and that gives you slight discomfort, or you feel that you're completely normal while your body just starting to shift itself into a different position and then start to become its norm. Here, when you go to the gym and you load your body bilaterally, you see the difference.
Yeah. Because there you're loading it evenly, but the body is not evenly developed.
Yes, exactly.
Well, it's kind of very brilliant and smart system, because when you think about it, you don't need to remind them anything, right? Because the pain is reminding them. The pain they came with, it's already the reminder, like, I can imagine if you tell somebody randomly, observe how you feel or how you shift when you drive. They might not do it.
Yes.
But if it's somebody who has a knee pain and you tell them, observe how you drive, because when you shift your hip, then you put your knee into this position, and that might be causing the pain. They will notice it immediately, and they will focus it when they feel the knee pain, right?
Yes.
So you don't have to remind them. Body will remind them.
It's causality, right? Cause and effect. So you just teach them how do they listen to the body. This is how you actually educate the patients. I mean, if people will go back and forth with different problems, maybe the same problem. If you think that your job as a medical practitioner, just to see the patient, prescribe medications, or just give them exercise, and so they keep on coming for the same problem, there is something missing here. My job is to manage their case, whether by myself, my colleagues, another professional, whatever it is. But one of the most important aspects that you should have is you educate the patient on what's happening in their body and how they should listen to it and manage their case. Because I don't want to see the same people over and over again in the clinic.
Yeah.
Right?
It's a problem if your physio is your best friend, right?
It's not a problem.
No, I mean...
No. It's not a problem if they're your best friend. It's the problem if you get to see them a lot.
Yeah. For the... Yeah. You know what I mean. Yeah, so... Well, I had quite a few people from Disc here, right? Current employees, former employees.
Yes.
It's very nice to see that everybody's doing it this way. Yeah. Or at least people I was talking with, everybody is like, we actually want to help and we want people to understand.
Yes.
Not just, do these, glute bridges and you'll be fine. Like, understand why. Yeah.
Unfortunately, this is what they teach in university. This is what they taught us. So I don't blame the people who practice this. They think they're doing the right thing. It's not like they're on purpose doing that so you come back to them. It's lack of awareness.
Yeah, but then there are people who are doing it like good, and then there are people who are doing it better.
Yes.
Yeah.
I remember a friend of mine once taught me, good is the enemy of great. If you're happy with being good, you'll never be great.
Nice.
Yeah.
Yeah, absolutely. That applies 100% here.
Yes.
Yeah. Because if you're okay with where you are, it's just complacent, right?
Yes.
And then you're not going to develop, then you're not going to learn.
And here where you just wait for your retirement.
Exactly, yeah. And, take a paycheck, whatever. Yeah. But what do you think? Because you probably know that group of people and also the other group of people. Many of them, you are in that community deeply, right? That's your life. So where is the difference? How these people differ, where that shift comes from when you all get the same education, or, different countries, maybe different approaches, but pretty much the same education. And then some people will step it up and they will be like, well, I'm not happy with how it's going on. And I want to do it differently. I want to do it better. And they found their way, like you do, or many other your colleagues. What is different between you and the group that will just do whatever they were taught and they are not really evolving?
I think it's 3 points. 1, how hungry are you to learn? How eager are you to grow? And how do you look at your job? If you look at that just a job that you show up, do your work and go back home, why progress? But if you look at it as a purposeful job that you are here to leave an impact, you are here to create change in people's life and you contribute in their well-being, here where the first two will drive you to grow and learn. So I think it's a matter of perspective at how do you look at your job as a medical practitioner.
So it's the intent why people are actually doing the job. All right. Good. You have Tima told me about this, and I'm very curious because I think that you already kind of hinted bits of it, but you were talking about something, and you pull out pen and paper and you started to write some schemes and whatever was it.
Yeah.
And it was seemingly simple task or simple thing to remember, right? Yeah. But you still analyzed it a lot. And then Time asked you, what is it, right? And that's some method you are using for understanding things deeper.
Yes.
Okay, can you explain it better? Because now I just like walked around it because I have no idea. Yeah, okay. I just know that you use some analytical approach here.
I came across this concept a few months ago by one of my mentors. His name is Professor Ahmed. He taught me that the brain understands better when it's a diagram. When you look at diagrams, flows, charts, pictures, your brain understands it better. And if you have the ability to transfer the knowledge you have or the point that you want to deliver into a diagram, it means you understood it, you created a structure for it, it's easier to explain it and easier to understand it.
Okay.
So it's basically, let's say someone wants to come to you and ask you, I want to create a podcast. You can sit and just tell them what do they need to buy, how do they need to speak, blah, blah, blah. Or you can create a framework on the things that you need first, what's urgent, what's important. You classifying it into steps.
Put it into categories,
categories, steps. You start with this, you end with this, and then you jump to this. So you create a roadmap for them to understand what does it take from the start until you establish it. So kind of putting your idea in a more organized way to explain it better.
Okay, and I kind of know the answer now. Anyway, where can you apply it? On what kind of situations?
Anything that you are curious to learn. As you said, it's tacit to explicit, right? I know this information, I need to teach it. So if you can turn it from information that you know that is bullet points into a diagram, here you can share it nicely.
Can you give me very detailed and specific example? Maybe something you used or some analogy for something you used?
Okay. Think. What can I share?
I asked you at the beginning if there's something you don't want to talk about. I was like, no, I'm open book.
I think I am an open book. I would like to think of myself that way.
Okay.
Reality is different.
Okay. Yeah, obviously.
I mean, I don't know how to explain it. I need to show you, right? I think I need to show you something to explain it better. This is, yeah.
You want a pen and paper?
No, I need my laptop. I don't have it, man. I'll show you later and then maybe we can share it somehow.
So let's say we'll just get a very, very basic example. Okay. You want to plan a holiday. Can you use it?
Maybe. Yeah, maybe doable for a holiday.
Okay, let's do an example on a holiday.
Okay, you start with the dates, for example. It's 1 week trip, right? You're going to 1, 2, 3, 4 locations to stay at, and you're staying certain days in each place, and you're doing the budget for each place instead of just writing it on a piece of paper as bullet points. You can do phases, boxes each day. For example, the location, name of hotel, how much would it cost, and then you go to the next day. So you explain the trip and in a visual way.
Okay, so the whole thing is mostly about putting it visually.
Visually, yes.
There.
Yes.
It's not necessary analyzing what you're going to do, because you can do that with bullet points as well.
Yeah.
Yeah.
It's just the way you look at it in your head, or you visualize it, and how can you put it down on a piece of paper, and which type of diagram do you use? Is it a triangle? Is it, let's say, hierarchy? Is it a chart? Is it,
like step-by-step flow?
Step-by-step, it depends. Flow chart, yeah.
Okay. So this all you just decide ahead of, based on what you are dealing with, yeah?
Honestly, I'm still developing the skill. and I practice it on whatever I can apply it just to develop that skill more. Okay. So when Timea told me about say, okay, tell me more. Okay, and then.
All right. So that was you practicing it.
Yeah.
Okay.
Any skill you learn, you need to practice it on different aspects. It's a skill, right? It's a skill for your brain to analyze this topic to turn it into that topic.
And how did you get into it? And did you take some course, seminar, or you just read about it and then you apply it?
No, I came across it through Professor Ahmed. He was explaining to me and my friends something called digital thinking and analog thinking.
Okay.
And what's the difference between them? Okay. And I Googled it, understood it, started to apply it, and that's how it works, I guess.
Simple as that. Oh, can you explain digital and analog thinking?
The digital, if I'm not mistaken, if I remember it, digital is the bullet points. Let's say when you have something, you keep on writing and you have bullet points.
Okay.
And you keep on adding bullet points and paragraphs until maybe you get lost somehow in your thoughts. The analog is when you have these charts, flows. When you have these diagrams from one point to another. I do this, I jump into that because of this. It's like strategizing something.
And you have kind of also in the charts you're creating, whatever type it is, you can have a flow chart, and within the flow chart you have a hierarchy. Yes. Because you spreading one point further.
Exactly.
And okay, so the whole idea is not to get lost, to be more organized,
yes,
to understand better, learn better.
To learn better and to teach it better.
To teach it better.
Yes.
So that's the goal, yeah?
Yes. If
okay.
Because again, it's information, right? You process it, you develop it. Now you understood it better. To make sure that you understand it, you can teach it. Like what you said earlier.
Yeah.
So the end goal of this is you're supposed to teach it better. So I don't think anyone owns knowledge. Whatever you learn, you should be able to teach. Mm-hmm. So knowledge should never stop at your doorstep. You should take it, improve it, share it.
Yeah. So, take what you can.
Yes.
Improve.
Yes.
Discard what is useless.
Yes.
Move on. Yeah.
Yes. But you need to share it.
I just one thing came into my mind now. I heard this, not sure where. Again, maybe Einstein. Probably not. But knowledge is never given. Knowledge has to be stolen, but not in a negative meaning of that word, like stolen, but it just needs to be taken by the person who is receiving. You can't give knowledge.
Yes.
Because you can give all the information you want, the knowledge might come through. Yeah.
Yes. Exactly. Yeah.
So this seems like pretty much a little bit different expression of the same thing.
Yes.
That you are getting so deep into it that the understanding will increase, and you actually can change your perspective on things, right? Mm-hmm. What did you use it on so far? Like basic stuff, or
mainly work, explaining my ideas for my colleagues through this. Yeah.
Okay. And working good so far, yeah?
Yeah.
And you can always build on it.
Exactly.
So now, like, your computer has like shit ton of charts.
Different folders, different flow charts.
Flow charts all over about everything, yeah? Okay, when we will go back to your physio practice, well, I mean, it's all interconnected anyway. What do you think are people doing wrong majorly when they need to go and see you? Is it that simple that it's just the lifestyle?
So lifestyle is one component of the problem. Another two major components is not recovering well, whether it was pushing through fatigue or not sleeping properly, and not being hydrated enough. So one of the regular questions that I keep on asking clients during the session, how was your sleep the past week or yesterday, the past few days, or few days before you get injured? Two, how was your hydration? Are you drinking enough water? Are you taking your magnesium? Are you recovering enough? Or are you just pushing until your body collapses? And sometimes if things are not clear, ask them 6 weeks before the injury, did you change anything in your training? And surprisingly, you would find that they change the volume, they change the type of training.
6 weeks?
4 to 6 weeks.
Why 6 weeks?
Okay, so whenever you have an injury, the body would heal itself within 6 weeks. There is a fracture, there is a torn muscle, it will take up to 6 weeks. So that's the normal process of recovery. It's 4 to 8, but we always take the average, which is 6.
Yeah. I mean, it's all roughly speaking.
Yes.
Yeah, it's not exact.
Yes. And if you notice what bodybuilders do, they always change their training program every 6 weeks. This is where I used to play. 10 years ago, maybe, or whatever. I was not a bodybuilder, but I trained with bodybuilders. And that was one of the tips they would share, that every 6 weeks you change your program because your body gets used to the type of load. So you need to change it. So if you change the way you train and the way your body's used to be loaded, because the body works based on loading capacity. You have certain level of capacity and you have your load. Whenever the load exceeds the capacity, the body will maintain. It depends how much you're pulling extra weight or you're pushing your body through intensity.
How much you exceeded it.
Yes, how much you exceed the volume or intensity. This is the load. So once you keep on pushing the load and the capacity is here and not growing, you will end up being injured. But if you bring the load significantly lower than the capacity, you won't improve. You need just to challenge enough the capacity while taking into your consideration your level of hydration as well as recovery.
Recovery in the meaning of sleep. Sleep mostly, yeah?
Sleep.
Now I have like 5 directions I want to ask now. Do you track sleep for yourself? No? Based by feel, yeah? Okay.
Tired sleep, just like yesterday.
No, I mean like if you have anything like HRV tracking or anything like that, you don't use it.
No,
yeah?
Old school.
Okay.
Tired sleep.
I was asking before, like, what outside of lifestyle is contributing to people coming to you, right? I mean, the hydration and recovery is also lifestyle, but it was in a meaning of the posture, right? Like how they spend, what position they spend the day in.
I won't say what position. I would say how long did they stay in the same position.
Okay. Yeah.
Okay. So does not matter to me. Does not matter how do you sit.
Yeah, but
It matters to me how long they stay in the same position.
Okay.
Because here will the body start to adapt itself.
Okay, so even we will go for air quotes the right posture.
Yeah.
For sitting. There's not such a thing based on this, right? Because even you sit there for 8 hours,
yes,
it's not good for you.
Exactly.
Okay.
Yeah. Let's say you got the most sophisticated chair and the most comfortable, and it has the ideal biomechanics to sit in. If you sit there for long hours, you will stand up feeling tight. It's not how you sit, it's how long you stay in the same position.
So what is the golden time?
Okay. Nice question. Never thought of it.
Like what is too much already?
Yeah. Nice question. Never thought of it. But let's say the way I've been approaching it, now you made me realize maybe I'm not approaching it efficiently. It's effective, it's not efficient.
Let's see.
So the idea comes from the concept of the body adapts to our movement. where, for example, have you ever been in a cast?
Yeah.
Okay.
Like nothing serious, but hand I got.
Okay, hand. Was it over the above the elbow cast?
No, just wrist.
Okay.
I mean up to wrist. It
Up
was
to
my
wrist.
little
Okay.
bones broken in my hand.
For how long you were in the cast, or in
Like 3 weeks.
3 weeks?
Yeah.
When you took out the cast, how was the movement?
Or weak and limited.
Limited, right?
Yeah.
Why?
Because I wasn't using it.
Exactly. It's not only you wasn't using it; it was limited to that extent. So the body goes, "Oh, I don't need the rest. Let me get rid of it."
Like the range was limited because body discarded the range.
Yes, because the muscle does not have the elasticity. It's not the joint. It's
Yeah,
not, it's not the structure.
Joint is mechanical thing that will work regardless, right?
Yes.
Yeah.
So it's the same example applies on the bodybuilders. Whenever they go to the gym, they add mechanical load to the body. The brain goes, "Oh, I need more capacity here. Let me build more muscles." They stop training. "Oh, I don't need all of this. Let me get rid of it." They get smaller. So the body adapts to our movement. The same concept. If I keep on sitting in the same position in the car, the office, in the coffee shop, the restaurant, whatever, crossing my legs, sitting on the side, leaning on my right side like most people do in the car when they drive with the left arm,
Shrugging.
you're twisting your spine, you have misaligned hip, and this is very common problem that we have here. I'm not blaming people for their lifestyle, but this is how it works here. So the way I approach it, I combine Dr. Hassan approach by loading the posterior chain, because you're not loading the posterior chain here. You're sitting in a flex type position. Your shoulders are internally rotated, so your chest and your hip flexors are very tight. Stretch them, load the posterior chain, create that balance in the body. This is the first step. That's the formula.
That's the secret formula. Yeah.
It's not secret.
Okay,
This is how we look at it.
I will give you a question that will a little bit contradict what you just said. When I had people with, like, the rounded shoulders, the office people, basically everybody, I find very good results with them if of course, I work on back, absolutely, but I don't stretch the chest.
Yeah.
I strengthen the chest.
Yeah. But how do you strengthen the chest? How do you strengthen the chest? This is the question.
Well, I mean, it is not one exercise.
Yeah.
It's everything possible, right? It's anything from dips, push-ups, bench, even isolated flies.
Yeah.
Well, I mean, everything. The point is, in that exercise, they need to feel the chest working.
Yes.
Not just doing the movement. Yeah.
Because the brain looks at the movement as a task, point A to point B. I don't know what I'm using unless they develop the awareness and they know what they're using. This is one.
100%. This is
that's the quality of movement. It's very difficult to teach people unless they have a personal trainer who knows what he's doing and he emphasizes on it. On the other hand, as you said, it's not stretching what you need. It's mobility. There is difference between flexibility and mobility.
Yes.
Right? Mobility is when you have active range of motion at the end range. How much active range of motion do you have at the end range? That's your mobility.
How strong you are in
Yes.
the end range.
Yes.
Yeah.
Here where the muscle becomes more, or let's say the elasticity of the muscle increase, the muscle recruitment increase, the efficiency of the muscle increase. This is what you need to release a tight muscle more than stretching. Stretching would be temporary for a lot of cases. You need to make the muscle stronger, but in a very specific way.
What you said, point A to point B.
Yeah.
I find that's one of the biggest challenges and problems of sport itself. That any sport, whether it's a game or, I mean, probably outside of bodybuilding, everything is focused on some outside object moving.
Yes.
Not the body moving. You know, like the jump is not about what muscles you use to jump. It's about how high your hip can get.
Yes.
Yeah. On throw, that's even more obvious.
Yes.
It's the object you're throwing.
Yes.
Yeah.
It's the task.
On the bar, it's where the bar is going, where the dumbbell is going, and that's the exact
opposite
of how we should look at the movement.
Yes, I agree.
Because the dumbbell at the end of the workout will be the same.
Yeah.
You know, but your body might not.
Yeah, makes sense.
So absolutely, like this is exactly what I'm trying to do as well. Just to build the awareness of how the things works, and if you do this movement, like this is probably the most asked question I give to my clients. What did you feel?
Yeah, especially the squat, huh? Especially the squat.
Hey, like if somebody will tell me that squat is the beginner's simple exercise, it's like no, that's one of the, to do it really right. Tough.
It is very technical. You need some sort of professional tips to know exactly what are you doing, where are you supposed to feel the load, and how do you push to activate the right muscles.
Yeah. When you were saying that 6-week rule, I just started to think, because you said bodybuilders are using it, body heals in that time. You used it as an example. You ask people, what did you change in your training 6 weeks ago, or roughly 6 weeks ago, and you kind of get to the root of the problem, because that's when the change started to come. That's when the body started to adapt to a new load, whatever, and that's how injury happened. Also in strength, but I would say it's maybe up to a discussion, but in like powerlifting, weightlifting, and strength development, the nervous system plays the huge role, right? The adaptation of the nervous system. But if you will look at the cycles, how they go, we say it's a 3-4 week strength cycle, or it can be 12-week strength cycle, but you always have 3-4 weeks of loading, then deload, and then testing 6 weeks again. Yeah. Or if there is no, after 4 weeks and 1 week deload, if there is no testing week, then you just do another cycle, and then the testing is after that. But it still is around the same time frame. So they probably understood that as well, right? People who develop all the strength programs and progressive overloads.
Progressive overloads.
Yeah. How do you train now, or what do you do?
I do the least challenging exercises. I just go to the gym, load whatever I feel like loading, just to have a pump, let's say. I would swim sometimes. I'm learning on how to swim, which is on YouTube and using water. I could relate to that example.
At least you have the tacit and the explicit.
Yeah. So I'm working on my swimming skills, let's say. And earlier this year I started to run in the morning when the weather was more acceptable to run in the morning. So it depends. I keep on shifting as I told you.
So that's still going on, yeah? Whatever you feel like.
Yes, exactly. I am at peace with this habit, and I actually, because of this, I've learned a lot of stuff in my life. So I keep on doing it on purpose now.
Okay.
I keep on shifting and changing.
Do you have a time period when you're like, okay, this, or you just go by feel?
By feel.
By feel.
Go with the flow.
Yeah.
Go with the flow.
Cool. When dealing with all these things with people, they come to you and you tell them, okay, so it's the position you are spending too much time in. It is the hydration, and it is the what was the third one? The training, right?
Yes. Training, recovery, hydration.
Yeah, the recovery. Yeah, the sleep. How much you feel you can actually impact them?
Again, my job is to educate, inspire them to understand what are they doing and how are they supposed to do it.
Yeah, I understand that, and
so it depends on how does the person takes it. As you said, you cannot force someone to learn. You just share what you learn, and it's up to them whether they take it, apply it, or no.
When the people who come to you will start to progress somehow, what is usually, you said you don't like people coming back to you.
Yeah.
Yeah. So what is usually your kind of goal to get them, set them free?
I mean, if you think about the reason why they're here because there is something limiting them from doing what they want to do. So as long as they are doing what they want to do, that's the sign of progress. Because they're not here because they want to move the joint into full extension or full flexion. It does not matter to them. It matters to them that I want to play with my child. I want to go to the gym and train pain-free. I want to do this particular exercise better. I want to pick up my bottle of water and sip my drink without pain in my shoulder. That's what they want.
Mm-hmm.
So as long as they're doing the tasks that they're being challenged with better and progressing, that's the good sign.
Okay, so
the tracking metric is their satisfaction in what they want to do, and the main let's say concern they had, and the main complaint they had. Why are they here? If you keep on getting better, because it's easy to tell someone, "Oh, my knee hurts from squatting. Don't squat." That's easy. Even my grandmother will give you the same solution. Right?
Well, many doctors are still giving this solution for exercise.
I think it's outdated.
Oh yeah, I mean,
I think it's outdated.
I have a client who got this advice when pandemic started. He stopped coming, and he was very sedentary, and I mean very probably all day. He's even working from home, and the pandemic, and he didn't really have to go anywhere. So, and after 8 months, probably his knee started to hurt. So he went to his doctor, and he was like, "Well, my knee is hurting," and he was like, "Oh, you should just rest it and don't do anything," And that's when it struck him that, oh shit, I can't even rest more than I do now, and it's still hurting. So it's probably not that, right? And then he came and we literally got out of it in 2 weeks or 3 weeks, because it was exact opposite.
Yes, exactly. This is the problem when you don't have enough time to spend with the patient to understand their lifestyle, the actual cause of the problem, and what do they want beyond complaining of this particular pain in the joint. So they're here because of pain in the joint, yes, but where do they want to reach? Because your job is to guide them to reach there. But again, I don't blame the doctors for not knowing enough. They are surgeons. They are busy with surgeries, with the recovery with their patients. These small problems that they are, in my opinion, they're not supposed to see. I think the system is made in the opposite way, where what we have today is the patient has to see the doctor first and then being referred to physio. While if you flip it, the load on doctors will be less in the clinic. They don't need to see 80 patients per day. Then with their team, beside the surgeries, beside the follow-ups and the post-op clients, these volume of patients need to be filtered. So, in my opinion, they should start with physio, and the physio, if they don't see that this case should be here, it should be referred to the doctor. So the volume on doctor will be less. They have quality of time with the patient to actually listen and find the actual cause and contribute in the treatment on a bigger scale. Because they are fabulous at what they do, but not every patient needs to go and see an orthopedic surgeon and waste their time.
Yeah. And everybody would get to work on their skill set.
Yes.
Because the doctors will only get the people who were already referred to them.
Yes.
Because it's out of scope and reach of
scope, or you need a different type of assessment, or you need another form of treatment method, for example. Maybe he needs an injection, maybe he needs cortisone, maybe he would need PRP, maybe he would need peptides, different type of medications. That's the doctor's decision to take. Not the physio. I can tell you that we've done this many sessions for this particular case, and he reached a plateau. He's not progressing more than that. Here, where he needs another opinion. go see the doctor. Or from the very first beginning, you see the case, you know that this should be straightforward to the surgeon. He would take the decision whether you start with this or that.
Cool. Yeah, I mean, I like it for sure because, I mean, not every doctor who is, even if it's a GP, right? Yeah. They will not tell you straight away, go to a physio, go to a chiro.
Yeah, because their exposure in our field is very limited, unfortunately. So
you mean they don't understand enough what you do?
Yes.
Okay.
Yeah, and I don't think it's their job to understand what we do. It's our job to promote what we do until they understand the bigger picture that we are a team. It's a multidisciplinary approach toward the patient that you do. They look at the body from this way, we look at it this way, we contribute it together. It's a teamwork for the patient.
So you think that they are not taking maybe physios and chiros seriously enough?
The majority, yes. They're not.
Mm-hmm.
The majority, they're not. Unless someone who's interested in sport or has enough exposure about what does the team does, they would understand. Other than that, to them, unfortunately, physio, just how you prescribe painkillers, you prescribe physio. Go to physio.
Okay. Not giving it a second thought then.
Yeah, I mean, what yani, even if you would go to their books, I mean, I've went through some of the orthopedic surgeons' books that they studied during the board or fellowship. I think that it's during their board. It's called Toronto Notes, if I'm not mistaken. I went through certain topics and I was just curious on how much do they share about physiotherapy, and I realized that it's kind of part of the guideline that you see the patients, for example, for this particular case, you start with painkillers, anti-inflammatories, and then you send them to physio, and then it's an injection if it does not work.
Really?
Yeah,
it's like the step one. If it doesn't work, step two.
Yeah, or you combine step one with step two. It does not work. You jump to injection, and then you jump to surgery.
Oh wow!
Okay, and this was developed before the physio evolved. So the pace of growth of physio and correlation to, let's say, another entities in the medical field is faster because it's relatively a new field. It's if I'm not mistaken, started after the Second World War. I think after the Second World War, where soldiers were injured and they needed someone to help them. So they started to train nurses into how to teach them to move better with their prosthetics, wheelchairs, whatever, blah, blah, blah. And then it evolved into a different entity where it was limited to that, while physios kept on researching, evolving, changing, growing until it became a different entity.
So you're saying that physio evolved way faster than the doctors were able to catch its significance?
Nicely said. Yes, I think so.
Okay.
I think so.
All right.
And I honestly, I blame physios for not promoting what they're capable of.
Okay.
I don't expect you as a trainer to understand enough what do I do in the clinic. You just know that this client needs to go and see a physio at this point. But what do? I don't expect you to know. If you know, that's good. That's curiosity from you. That's knowledge from you. That's exposure from you. But I do not expect you to know what I do. Same thing with the surgeon. He has enough to understand, to practice, to learn, to grow. He's not responsible to go into a different entity and understand what do they do. It's my job as a physiotherapist when I work in correlation with an orthopedic surgeon to have a discussion and share what do I do and how to strategize a treatment plan for the, let's say, common case.
I think I'm looking at it a little bit differently because I have a kinesio background and I always actually thought that coaches should know more.
They should.
I'm not saying that they need to be as efficient in all the practices, but they should definitely strive to understand the body as much as any physio.
100%.
Yeah, as much as physios, from my experience, should strive to be better at coaching people, because that's from my experience with some people, that they understand body to an amazing level. They can do the diagnosis very well, but to guide them to do good squat, it's terrible. Like
Yes.
I can't watch that sometimes. You know what I mean?
That's the gap, I think, between physios and trainers. And here where, let's say you have X-patient recovering from ACL reconstruction surgery, you have his 6 months progress, you're religiously working on his rehab or through the protocol that's been set between by a physio and orthopedic surgeon for 6 months, and then he wants to go back to football. It does not happen overnight. It's not like that you are working for 6 months and then you expect him tomorrow to be on the pitch killing it.
Yeah.
There is a point where two things merge. Here where only an efficient physio who has enough knowledge and exposure to guide him on how to go back to the pitch, as well as a good trainer who understands how does rehab work and to transition into back to full potential on the pitch.
Yeah.
So here where I think the missing point for a lot of physios and trainers, that it's either you learn more from this side or you learn more from the other side, and
there is still a gap.
Yes,
Yeah,
yes.
yeah, for sure. In a daily practice, there are. I know about Anya, and she's doing bulletproof performance.
Yes.
You know her?
Yes, of course.
Yeah. Well, she was your colleague, right? Yeah. So she's doing exactly that, specifically for volleyball players. That she is offering in her program the whole journey. She's also coaching them, the volleyball, and I mean, she's not coaching volleyball sport specifically. She's doing strength and conditioning for volleyball, but if they have some injuries, she also can help them to guide it through. Nice. Because she has the best from both worlds.
Yes.
Yeah.
Exactly. She understands the needs.
Yeah. And how it all interacts together. I wanted to ask you about that, like to get a little bit more specific about the guidelines you said. Like you ask people about hydration. Okay, so what is the good hydration, or what you would consider good hydration? What are your recommendations for that?
Look, if you would Google that, most references would refer to liters to 3.5 in our weather, but globally you're speaking about 2 liters of water. But if you would consider the weather we have and you look at what's, let's say, published or recommended, is 3.5. 3.5.
And would you put into regard a body weight, for example?
I'm sure there's a formula, but honestly I'm not aware of it.
Okay, from what I know is 0.035
0.035
times your body weight, which means for 100 kilo guy or girl, I mean, you can have 100 kilo, it's fine. 100 kilo person, it's going to be 3.5 liters, because it's like 0.033 to 35. Yeah. And that's like generally applicable, but it's not taking into consideration the weather.
Yeah.
So I would definitely go like easily half a liter more when you are in this kind of weather. But I know, I'm just curious about your.
Okay.
What would you, or how, when they have a mess up sleep, what do you recommend them to do?
Depends on the reason. Mainly, first solution is magnesium.
Magnesium. Supplementation with magnesium.
Yes.
Why?
It helps the quality of sleep.
Do you know what processes are involved there, or isn't magnesium GABA precursor.
What's GABA?
GABA, it's the glutaminergic butyric acid, something. It's a...
Does not ring a bell.
Okay. I'm sure something butyric acid for sure, but I messed up the first part. It's just the shortcut is GABA. I know the name in Slovakian, but I can't. I don't know I know the GABA, and that's like an opposite of glutamate. Where glutamate you have spike, that's a excitatory mediator, and GABA is suppressing it, which means it's going to calm you down.
It's a blocker,
I'm almost 100% positive that the magnesium is helping GABA to work. So I'm just thinking about the pathway, why the magnesium.
So the magnesium does not help you fall asleep.
No, I know that, yeah.
Yeah, it helps you in the quality of a sleep. So when you wake up in the morning, you feel that, okay, I slept better. I feel
okay.
better. Yeah.
Okay, so magnesium for that, yeah?
Yes.
How much?
It depends on the company, depends on the formula.
Okay.
So I don't think there is...
Ask your pharmacist.
Ask a pharmacist or just read what's on the pack from behind.
All right.
But really it depends on the company and the formula. Because it differs on what type of magnesium are you taking.
And when you're asking your patients, like, okay, so what is your sleep like? All right. What are the things you're looking for?
When they wake up in the morning, how do they feel? Tired, shattered, or it's more of energized?
All right. That's what the Whoop is asking you as well every morning.
How is it, by the way? In terms of data and do you think it's affecting the way you train? Because I've heard different reviews about it.
Yeah. I was never, I can't say never, but almost never really into endurance. Okay. And the strain, the Whoop is calculating you. It's calculated purely, the strain is purely calculated from the heart rate. So I can tell you that if I go for a recovery, easy pace, rower or bike, I will have a higher strain than if I do 5x5 back squat and I kill myself under the bar. Because the heart rate is, it's calculated as how long time you're spending in what heart rate zone. So if I only spike there because of the set of the squat, then I rest, it goes down, it doesn't calculate high strain. Yeah. So I believe it's great for tracking. I do it for tracking sleep, mainly deep sleep, REM sleep, light sleep. It tells you everything. It tells you when it was. It tells you how long it was at night. It tells you compared to your averages, if it was more, less, on point. It will give you all possible, like insane amount of data. I can tell you that average user is probably using like 10% of what you can use it for, because it gives you so much. It's not even possible unless that's your life. Like you are an athlete. Like it gives you so much data, but the strain part is limited in the aspect of it only calculates based on heart rate. So for endurance athletes, for sure. Yeah, if somebody is an ultra runner or runner, marathoner, and they basically have very little strength training and they mostly do the long endurance training, they can see so much more patterns in it. But for example, for powerlifter, to track their sleep, cool. To track their training, useless. So yeah. However, you could be smart about it, because I am looking at HRV as from night. So let's say on Monday I train heavy and I lift only, so there's no cardio. So the strain of the workout doesn't really matter to me, because it will be like nothing. It will be less than significant. It will tell you like, oh, you spent in this aerobic recovery zone most of the time. But if I look at Tuesday morning I look at the sleep data and I look at my HRV at night, I know how the heavy training might have impacted my nervous system. Because the HRV is basically just showing you parasympathetic versus sympathetic. That's it, right? Like the activity. So like it's interesting. I prepaid for long time, because the more you prepay, the cheaper it gets, the better plan you get. But I am not 100% sure that I will renew the subscription.
Okay, interesting.
Yeah, like you will actually eventually be able to, exactly based on how you feel, learn a lot. I was also experimenting. That might be interesting for you. I have the hand grip. What do they call it? The measurement of the hand grip. Dynamometer, is it called? Dynamometer. Yeah. So I was measuring that and look at my HRV. So in the morning, the first thing in the morning, I squeezed as hard as I could. It was very strong correlation. So if my HRV, my activity of the nervous system, I was good at it and I was rested, I got higher score. And if I was shattered, I got lower score.
Interesting.
So that was very, I mean, you don't need Whoop, just get the dynamometer. if you really want to do that nervous system.
And you don't need subscription for that.
You don't need subscription. You just buy it once. It's way cheaper for sure. But it's an interesting experience, because you can see a lot. Yeah. And I wanted to also ask you, because you still didn't really answer, and even you don't have an explicit answer. Tell me, what would you say is too long enough to sit in one position? So because when people need to be in the office, like how often you get up, walk around, or at least change, maybe people can change from standing desk to seated desk. Yeah. Maybe, what would be the time frame?
The advice I usually use, it's 30 minutes to an hour. It depends on your workflow. So if you're very busy, I mean, it's not like in the middle of the meeting I ask you to stand up, right? It's not doable. But let's say half an hour to 1 hour would be ideal, just to break the pattern. Just to break the pattern. Does it answer?
Yeah, absolutely. Yeah, well, I'm just curious, if there is some reason for it behind, like fascia movement or stiffness or anything like that. What do you think of AC and non-AC and...
personal opinion? I don't understand people who don't like AC. I am from the region. I live with on AC, even in winter. Right?
Discard the question. It's pointless. So you don't mind going from 45 degree outside into AC room? You used to it, yeah?
I mean, it's a blessing. Why should I deprive myself from a better weather?
It's a blessing. All right.
It's like God gave you an elevator and you still decide to use the stairs.
So you don't use the stairs, yeah? Because
only going down, or in case there is fire.
Okay. That's a lifestyle specialist, Ahmed.
See, just like Maradona. Just like Maradona. You can give a lot of advices as a professional, but it's not necessarily that you apply them.
Yeah, like, do as I say.
I am the coach, not the player.
do as I say, not as I do, right?
Exactly. Exactly.
Yeah. Well, but it's probably easier to follow if you go by example, right?
But by example, yes, that's a lot of discipline and let's say a lot of integrity and high level of self-care would go into there, because a lot of people know what's right, but not everyone does it.
Oh yeah, absolutely. Hey,
everyone knows that they have to eat healthy. No one, but it's not like if you know it, you have to do it, or if you know it by default, you will do it. It takes self-discipline to eat healthy. It takes self-discipline to be consistent in the gym. It takes self-discipline to be a better person on a regular basis. It takes self-discipline of taking care of your family. It takes it takes a self-discipline to be a good father, a good partner, a good parent, right? Everyone knows what they're supposed to do, but not everyone does it.
Yeah, the thing that we know doesn't mean that we apply it straight away. Yeah, for sure, because then we wouldn't really have any problems, right? Yeah, and okay, so going more into psychology of this for you, how you manage that, you know?
In terms of what?
Oh, anything, like what drives you, where you get your self-discipline from, in whatever you have the self-discipline, because you might not, some people might not have a self-discipline in the food because they're like, I'm not giving up anything, I will just, but when you see them in the gym, you almost feel sorry for them not taking care of food because they are working so hard. And if they would apply that same discipline to the nutrition, it would just, do it for them.
Yeah.
So
if it's me personally, from where do I get my self-discipline drive?
yeah,
I would say work.
from the work, yeah?
Yeah. Workaholic. Big
Yeah.
time. Yeah. Number one's work.
Number one is the work. So
It's not that I'm promoting this. I'm telling people put work always first, but
no, I ask you. Yeah.
It's a personal preference.
So the development and professional growth
Yes.
is about almost anything.
Yes.
Yeah. So if you have to decide between good night's sleep and work,
Work.
good nutrition and work,
Work.
always work. All right. Okay. Have you always been like that, or
It depends. Yeah. We go through phases, right?
okay?
So currently I'm in a phase where work is number one.
Well, I'm very glad you found your time to come, and you're not at work. Do they kick you out of the clinic sometimes? Like, Ahmed, this is too much, go home?
Not to that extent. Not to that extent. Because seeing patients something, let's say the other work is something different, which I get to do even on this won't be shared on the podcast if it's possible to. Mainly the actual work I do it at night or at weekends. I'm not supposed to do this. I'm advised by management not to overdo it.
Yeah.
But since the drive is there, I just go with it.
Do you think you might be like a little bit autistic or something about this?
Autistic?
Yeah.
Interesting. Never
Like
thought
on
of it.
like on spectrum, you know?
Okay.
Because usually, I mean,
This is interesting. Tell me more.
It's not an insult.
Yeah,
okay?
it's okay. Don't worry about it.
But many times,
Yeah.
people who have this insane drive towards something,
Yes.
they are by certain parameters on a spectrum,
Interesting.
like obsessed.
Yes.
Like they can't stop thinking about it.
Yes.
They always feel they are not good enough at it, and so on.
The imposter syndrome kicks in.
Yeah, basically
Yes.
imposter syndrome. Yeah.
Interesting. So I'm autistic. I did not know that.
No, this I don't see autistic people or people on spectrum as a sick.
Yeah, no.
It's a different way of functioning. It's maybe not widely spread.
Yes.
But it's a different way of functioning compared to what is considered normal,
Exactly. I mean, as a physiotherapist, at a certain point of my career, I got exposed to work with autistic children. And I think they are very smart people. They are very smart because they would take one thing and perfect it like no one can do it.
Do you see some? Do you see some analogy here now? It's not a label that you suffer with.
Yes.
It's just something you can use for your advantage, right? Because
maybe I am, but no one ever told me that.
Yeah. I mean, that's a without diagnosis, right? But you can be sure that maybe 80, if not more, % of programmers in Apple, Google, all these people, they are on spectrum.
Interesting.
Because they are so good at what they do because they love it so much. And a balanced person, with the different values will not be able to sit there and do it for 14, 16 hours straight. But because they love it, they can. That's why the companies are creating such a unique environment for them to feel good there. So they keep them, because they need that high performance. And it's not necessarily bad because they found something they love. And well, isn't that the point anyway? Yeah.
I mean, yes, because if you're passionate about something and you work in the right environment for it, you reach something called the state of flow, where you don't realize time is passing by. Whenever you are doing something that you are, let's say, you define yourself by, and it's part of your identity, and you enjoy it, and you're passionate about it, and you do it with some sort of autonomy that makes you enjoy it. That's called, if I'm not mistaken, two types of passion: obsessive and I don't remember the other one. But there were two types of passion. First type is where you reach that state of flow.
Okay.
That time pass by and you're not aware of it.
Have you studied state of flow?
No. I just read one paper about it.
Oh, really? Okay. I did my bachelor and master degree thesis on that.
No way.
Yeah.
No way.
Yeah,
No
I
way.
was. It was like an observational study or whatever you call
Nice.
it, and of course there was a part where I described what it is and what we are looking for, and
Yes.
all the
Nice.
theoretical
Yes.
part.
Yes.
But the main thing was that I was through a questionnaires finding out what are the differences in experiencing state of flow in Brazilian Jiu-Jitsu and in yoga.
Mhm.
And it was separated into age groups, level of skill, and so many attributes. Yeah. So yeah, state of flow. Yeah, you have the guy who described it. I think he died actually. He was Hungarian origin. His name is so complicated. I can spell it very well. I don't know how to say it. I've written it down so many times. But there was, as you said, time flows differently. That's one of 8 aspects he described.
Okay.
Yeah, it's like also these questions in these standardized questionnaires, they are based on these 8 areas.
Interesting.
Yeah, and it's about perceiving time differently. You feel that the task is not too hard and it's not too easy.
Yes.
Because that's where you need the balance, right?
Yes.
If you have, that's also something he described. If the task you're going to do is too hard for your skill, so the difficulty is high, skill is low, you'll be frustrated. Leads to anxiety.
Yes.
Yeah. So if let's say we go horse riding, okay, and we have a race, I'll be super frustrated because you know how to ride a horse, and you will be bored. That's opposite. When your skill compared to the level of difficulty is way too high. Yeah. So your skill is too high, difficulty is too low, you're bored. And the flow become possible when you find a channel where the skill
Sweet spot,
and
basically.
challenge are matching,
Yeah.
and that's also on the little level, it can be a little skill with little challenge, and then higher skill, moderate challenge, and then how it grows. So it's infinite,
Yeah.
The only problem might be if you'll be good at something where you need an opponent and you can't find anybody good enough.
Yes. That's the challenge.
to
That's the
challenge you.
challenge.
Yeah. Cool. Ahmed, do you have anything you want to add? Say.
Thank you for the invitations. Thank you for having the time, the nice questions. Yeah, you made me
My
realize
pleasure.
stuff. You made me that I need to expand my knowledge in certain aspects and attributes. Thank you for the knowledge. Thank you for your time.
Well, no, thank you. You shared the stuff. Thank you so much.
Thank
It was very interesting, very insightful, and again, very different to what I was talking with many other people before. So, thank